record.
Oh, Madison says she showed up with the old link and it was redirected, so that's good.
Oh, great. Wonderful. Good. Okay, so when I switch, can you see it?
Yeah.
Okay, great. All right. So it is showing me that it's recording.
Perfect.
So I am going to get started. All right. Hi, everyone. My name is Elizabeth Dunnick. I am a BCBA with the Health-West Autism Program. And joining me today is my good friend and colleague, Emily.
Hi.
She is also a BCBA with the program. So yeah, today we're talking about daily care skills and systematic desensitization. So first things first is we kind of want to know who you are. So I'm going to throw up a poll because I love polls. And you can take a couple seconds to fill that in. It's multiple choice, so you can choose more than one if desired. Yeah, and then we can just get going. It's really helpful for us to know who's here so that we can kind of get an idea of what audience we're speaking to and so on and so forth. So it seems that we have some professionals, some parents here to help with our presentation today. Well, not help. It'll be me talking, but to be present with us. And that, again, it's very helpful to know. So some things you need to know about this presentation is that we really appreciate your patience with us. Zoom is a technological thing that I made up that word, that we are still getting used to, still finding caveats of how to do it best. For this one today, we are recording it. So that is something that we'll have access to over our YouTube station, Health-West YouTube station, so that we can watch this later, or other family or community members can have access to this. If you have any questions or comments during this presentation at all, feel free to go to that chat. Emily will be monitoring that throughout the presentation. So we'll do check-ins to see if there's anything that needs to be talked about. Otherwise, we're just going to keep rolling. This is scheduled to go until 5. We might end early. Who knows? Maybe I'll just continue to talk, but we'll see. So again, today we're talking about daily skills. It has 2 parts. Today has 2 parts. First, we're going to talk about daily living skills and teaching skills when our children seem to be afraid of the task at hand. So that is speaking to daily living skills in kind of this thought of systematic desensitization, which is something that is used in the field of ABA. Background, if you've never heard of ABA, or you're like, oh, I thought this was something else, Health-West Autism Program is rooted in applied behavior analysis, taking behavior as kind of the center of how we practice and figuring out ways that we can increase skill sets while decreasing target behavior or problematic behavior to the environment, while coming alongside families to help ensure consistency and fidelity so that the child that we are working with can have the best quality of life and integration for their life. So elevator speech, that's what we do. So part 1 of today's presentation is systematic desensitization. You'll hear that word a lot from me in that first part. Part 2 is specifically talking about the nitty-gritties of toileting. Yes. What's poop got to do with it? We're going to talk about it. So those are the 2 parts that we're talking about today. So daily living skills. When we're talking about what kind of skills are we teaching our kids that we can use systematic desensitization for, we can use that sort of process for brushing teeth, nail trimming, toileting, wearing deodorant, changing is spelled incorrectly, but that's what the word I meant, changing pads, getting dressed, brushing hair, cutting hair, blowing one's nose, public bathroom use. That's a lot of skills that we may want to teach our kid. So those are the skills that we want to teach, but how do we get there? I mean, how do we teach these skills to our kids, especially if they're afraid of, maybe they don't like the sound of the hair trimmers, or maybe they may approach a public restroom and they're turning away from it. They engage in this behavior that would be categorized as scared or afraid, and we're going to define that soon too. So when we're working towards these things of developing these skills and systematic desensitization, before we get into any of that stuff, we're asking these questions. What skills does a child already have? We need to know that when we start the process of systematic desensitization to teach daily living skills, to know kind of where we're starting. Are there any other skills that we need to teach the kid besides possibly the daily living skill at hand? Are there any medical conditions that may be related to why this child is showing fear? If they have some sort of issue with their mouth or their gums or their teeth, is that playing into why they're hesitant or showing fear towards brushing their teeth? Those are the types of questions that we want to ask ourselves. Is the child seeking other professional help to assist with this skill? Are there other professionals that need to be brought into this process, just so that we can all be on the same page of how we're going to be consistent? Because at the end of the day, our hope and our goal for these children that we work with is that they experience consistency across different environments so that they can have the best quality of life. So our focus on this part one of this discussion is teaching skills when our child is afraid of these activities. That grammatically doesn't make sense, so I'm sorry, but that is a typo. So afraid is running away when seeing something associated with a skill, crying, falling to the ground, screaming. These are what behaviors that we mean when someone is showing that they are afraid. So what's the process of systematic desensitization? It's teaching relaxation skills, if possible, in order to extinguish fear and anxiety responses specific to a person's phobia. And it establishes a hierarchy of fears. So the goal of this process is that an individual will learn to cope and overcome the fear in each stage of the hierarchy, and will not move on to that next level of the hierarchy until the current level is no longer producing that fear and anxiety response. So while we're teaching these or breaking down these big skills into smaller steps, we're having the child identify relaxing techniques to help them get through the process of exposure. We're going to talk about too what happens when our kid is demonstrating that fear and wants to leave when we're exposing them to that part of the hierarchy. So systematic desensitization breaks down a skill. So with the approach, we're breaking down the daily living skill into steps, or break down the exposure to the item that the kiddo shows fear towards. Each step builds on one another to create the overall behavior we desire to see. So one of the biggest things that I have personally and professionally have had a lot of experience with systematic desensitization is nail trimming. Nail trimming is a goal that a lot of parents have for their kids, for them to be able to partake in without experiencing fear or anxiety towards. So it's breaking down all those little steps of what goes into having your nail be trimmed and exposing slowly the child to each phase so that they become more and more comfortable with the task at hand. Systematic desensitization helps overcome the phobia related to that daily living skill and leading to the desire to engage in that skill. So what it really means is that there's a series of extinctions of the fear response shaped over time. Well, that's a loaded ABA sentence. Let me just break it down for you. So extinctions were withholding previously given reinforcement. So even though during the process of systematic desensitization, we're allowing the child to leave, which is like, what? You let the child leave? So if I were to, I'm going to use nail trimming again as my way of the skill I want to teach. So if I'm doing nail trimming in my first phase, you think about all the steps that go into nail trimming. The first step is having the nail trimmers be in the same room as a child. Like that's it. That's the first phase of this whole process. And we're bringing in the nail trimmers for a trial, and we're just setting them in the room while the child's playing, not even acknowledging that they're there. The child, may react. Let's say that if they do, they show that afraid, which is as defined in the previous slides. They turn away, we remove the nail clippers immediately. And then we may bring them back. And over time, we're bringing them back to show the child, hey, what used to make these things scary to you is no longer there. We're withholding that previous, the previous consequence. So then over time, the child becomes more and more used to the nail trimmers being part of their life without the, big exercise of clipping the actual nail. That comes in time. So I've already said that second point, so I'm just gonna keep moving. So what about this? Who came up with this idea? Well, we can thank a lot of people. There's a ton of other people that are included in this process, but I really want to include Mary Cover Jones into this combo right now, because look at her. I mean, she looks like she knows about phobias. Look at all these snakes. I'm pretty sure she drew this drawing. No, I am just kidding. She didn't. I don't have any research behind that, and I don't know that. So that's not real. Okay, but seriously, guys, let's talk about Mary for a second. So she developed this technique known as desensitization. Such a fun word. Try to say that 3 times fast. Are you doing it? No, I can't because you're all muted. To cure phobias, she repeatedly introduced an adverse stimuli paired with a pleasant stimuli until the fear response was gone. I mean, look at that kid with that bunny. She just wants to love on that bunny. What were you saying, Emily?
Look at all those M&Ms.
Yeah, it probably took a lot of M&Ms for that to happen.
Yeah.
But yes, so she definitely was one of the foundational leaders in systematic desensitization. So we think about behavior, we think about, okay, we want to teach a skill. We want to understand as behavior analysts what is the common antecedent and what is the common consequence to this behavior of fear that we're seeing. So we're seeing that there's an adverse stimuli present, which in this case, I'm just going to keep riding with that nail trimmer example, which is the nail clippers. The behavior: cry, scream, run, fall into the ground, saying no. That is the afraid, or the fear, the anxiety. And then the consequence is escape from the aversive. So in our mind as behavior analysts, we're seeing that and saying this behavior serves the function of escape, because when the nail trimmers are introduced, they are escaping. So they're escaping the task. But here's the thing about systematic desensitization is that the key is that we actually feed this function, let them escape when that phobia is presented. Like I said earlier, if that nail trimmer comes into the room and they say, no, we'll remove it. And we don't give any extra attention to it. We remove it and then we try again. And we slowly begin to extinguish and teach breathing skills or teach relaxation skills, so that the child has this replacement skill of getting through that anxiety, and knowing and showing them through these continually exposures to the skill at hand that it's going to take time, but it's going to be okay. We're going to work through this together. So systematic desensitization allows escape. This slide says that we allow it before avoidance behavior, and that is most likely in the physical form. I mean, we can't sometimes physically know that a child is going to escape until they either tell us or they physically move. So sometimes that indication to us does tell us to remove the signal, the point of the hierarchy, in this case, the nail trimmers, while it's happening, and that's okay. We offer a lower level of aversive rather than going right to the clipping of the nail. So we're starting when the nail clipper is right in the same room as a child, instead of going and exposing the child right to having their clipping their nails over and over and over again. It's a hierarchy. It's breaking down the step into smaller steps and then slowly exposing them to one step on top of another, on top of another. So as soon as they get comfortable with the nail clippers in the same room, then we'll, let's say as a behavior analyst, we bring that nail clipper in, okay? They're not showing, so we would define what is a positive trial and what is an, negative or incorrect trial. And an incorrect would look like if the child was admitting, crying, screaming, falling to the ground, saying no. That would be deemed incorrect, showing us that they are not ready to move on to the next phase. A correct trial would be that they don't respond, it stays the same. Basically, they're playing, they're doing their thing. So then I may say as a behavior analyst, okay, when this child on this phase 1 of nail trimming, which is bringing the nail trimmers into the room for 5 seconds and laying them on the ground while the child's playing, if the child has displays correct responses for this trial 3 days in a row at 90% of all occurrences, meaning that, let's say the parent or the technician introduced 10 trials that day, and 9 out of the 10 the child continued to play without engaging in the avoidance behavior, then I'm going to mark that day as a day towards moving on to the next phase. So that child shows 3 days of 90% or higher, then I'm going to move on to the next phase. Next phase in this case, we may determine, is bringing the clippers within 3 feet of the child while they're still playing. So we're not moving from in the room to on the hand. We're moving from in the room, across the room, to in the room within 3 feet of the child, to in the room, next to the child, and then we just go from there. That's the process of what it looks like to desensitize the child to this daily living skill in a systematic way. Systematic desensitization. Yes, so like it says, for it to be truly ABA, we're looking at what are those definitions of the behavior we want to see. What are the definitions of the behavior when the child is experiencing anxiety or fear? What are the data measures? What is the mastery criteria for each phase? Because they have to move on, that we want to move forward in order for that child to be able to have their nails clipped. So those are the things that we're looking at and allowing during systematic desensitization. So the spiders. Some people just really don't like spiders. The way of spiders, Emily's like, no. The way of spiders with systematic desensitization is that, it's introducing possibly a fake spider first, over there, way over there across the room, and then, oh, it's gone after a second. And then praising the child, like, you did really awesome. You did really awesome not being afraid of that spider. And then we may intentionally say, oh, look, a spider. And then we'll be like, oh, we're not going to pet any fluffy spiders, but, a fake spider, we might pretend to fluff, fluff. I meant pet, a fluffy pet, a spider. Are you tracking with me, Emily?
Yeah.
Okay. So that's that. Do we have any questions or comments in the comments? Okay, great. Yeah. All right, I won't keep moving. Thanks for sticking with us today, guys. All right, so here's some data. Ooh, I love some data. It looks so pretty, except for, ooh, I'm looking at that number 15 at the bottom, where there's that little dip to 0%. I'm wondering what happened there. So we can see that through this data, you can see the 1, from the 100% all the way to the left, there's 0 to 100%. And then there's that space and it says 1. And then there's another space and it says 3. And another space that says 4. Between those blue lines is the phase in which the child is participating in within the nail trimming hierarchy. So phase 1, between, trials 1 and 2, you can see the session number at the bottom. You're seeing that within those 2 sessions, the child got, it looks about above 80%, which, seeing how it is in these things, could be 90% or higher, because as you can see in the next phase, there is a dip to 80% and they didn't move on to the next phase, telling me that 80% is likely the percentage. So I'm unsure, I didn't make this graph, but it just kind of gives that visual representation of what data is looking like to us as behavior analysts to help us decide when we're moving on to the next phase. So something that's really important is what happened at session 15, phase 8. And this speaks to a lot of things, and how it's important for us to follow the protocols when exposing our child to daily living skills, because what we can do is actually go backwards. So percent responding to nail trimming phase 9. So this is a percentage of when a staff member did not follow the protocol, jumped ahead in the phases. So they possibly were, phase 9 is pretty far in the hierarchy. So they possibly were like when the nail trimmer is inside the nail, but they don't clip, but that staff may have accidentally or not accidentally clipped the nail. And so then that is sending the child backwards into likely some regression of sorts that has to be sorted out and gone back to, because the child wasn't ready according to the data to go move forward in the phase, and it happened. This is why it's so important as behavior analysts to continue to supervise and monitor treatment plans and how they're implemented to ensure that fidelity is taking place. And as parents, I did see that there's a few parents here too. It's really important to be really in the loop regarding your child's treatment, so that you can have those second eyes to be in correspondence with, the supervising BCBA or master's level at hand, and to have open communication even with the technician too. I mean, things just go so much smoother when there's all that open communication between all stakeholders and an individual's treatment.
And I think, Elizabeth, I just want to add, sometimes the hard thing is that this can take a really long time, or feel like it's taking a really long time. It's not a quick fix. It's not something that you see over a week or sometimes even a month, depending on the skill. And so as parents, it's really important too to wait it out and know that it will work with consistency. You can see that same regression happen sometimes. I had a child who was working on haircut, and we were slowly getting the hair clippers closer and closer and closer, had beautiful data, and then all of a sudden went, uh-oh, what in the world happened? We went from, 2 weeks tantrum free as we're working through this to, oh my gosh, unbelievable, 10 minutes trying to get this child to sit. And lo and behold, parents over the weekend had said, we couldn't handle it anymore. We just had to cut his hair. So we pinned him down and did it. And then it was like, ooh, yeah. So now we have to go back and kind of retrain some of those steps to say, it's okay. It's not as scary. And so it's important to stay in communication and on the same page so that we don't see that regression.
Absolutely. I think those are just really great points for sure. Yes. So, we're talking a lot about systematic desensitization and how we're exposing a child to, parts of a skill that may be scary to them. But just overall, when we're teaching skills to kids, and we'll talk about this a little bit in the toileting part, we are breaking down that skill more times than not in the ABA world into smaller tasks associated with that skill, whether it is nail trimming and maybe they're not afraid of it, but it's likely that they're coming to us with need of assistance for that because they are afraid of it. Because if you are already doing nail trimming, you wouldn't necessarily need assistance with it. But even when you are teaching a kid to tie their shoes, you're breaking down each one of those loops for the child to engage in slowly, and over time with more practice and more opportunities, that child is going to gain more and more ability in that skill, given that they have the prerequisite fine motor skills and the ability to concentrate on a task for up to 3, maybe even 5 minutes. So even though we're just specifically talking about how systematic desensitization teaches daily living skills, we also use task analysis in this first point to teach daily living skills, whether they're afraid of that skill or not. Those are huge, not the only way to teach a skill, but it's certainly one of the first steps that is pretty prevalent in the ABA field of what skill are we trying to teach and how do we need to break that down so that we can provide reinforcement and shaping, which shaping is, praising the approximations to get to the skill at hand. If you're teaching a child to talk, my son right now is learning to talk, and right now we're reinforcing babbling behavior, because even though it's not the word that we want to see, we're getting there. So we're praising the use of language and how it's giving him what he needs in his environment in certain ways. So just like that, whether systematic desensitization is being used to teach a daily living skill or not, we're still looking at what is the overall task and breaking that down into smaller steps. So yeah, I think I already said this stuff. I'm going to continue to move on. This is where Florida Autism Center has used systematic desensitization for. Yeah, it's a powerful tool. It definitely can be a very powerful tool. Like Emily said, I mean, it's a long haul situation. It can take upwards, sometimes even 6 months. And that's why sometimes the timing of these types of programs are super important. Do you want to run this program during the summertime when they're not in school, so there's less likelihood that they're going to scratch another kid? Or do you want to run this program when you're going to have more opportunities to be in the public, going to the public restroom? Maybe you can run it through the year, all the time, because you're on public a lot. Yeah, not necessarily right now, but
I was going to say,
safely.
Right now that sounds
in the olden days. So anyways, moving on. So food refusal, huge one. Introducing that food, not providing any pressure to engage with that food, just looking at it. There's a great, introducing new foods. We have a great video on that on our YouTube, on the YouTube page that this will be linked to. If you go to the Health West site and you go to the virtual groups page, right where you can find the link to join this session, there's also a link underneath it to see all of our previous recordings of the topics that we've talked about. So we can use systematic desensitization for food refusal. Yeah, I'm just gonna keep going. So if you're thinking at home, I need to, my kid is having a hard time with nail trimming or hair grooming, I want you to be aware that bringing in a professional can be very, very beneficial to be a sounding board and provide direction during this time, because it can be tricky, especially when you're dealing with anxiety and phobias and things like that. We definitely want to acknowledge that it takes a group effort, because like Emily said earlier, you can get tired of allowing the escape to occur, and it's really important to have that person being like, you got this, look how much progress this child has made, we're going to keep going, let's look at the data, look how far they've come, and kind of getting that reset. When we're doing the task analysis or breaking down the skills professional, step one is us looking after we've, ruled out medical factors or seeing what type of prerequisite skills this child needs to have in order to attain this skill. We're looking at the task, breaking it down, and remembering that with systematic desensitization, it's not always doing the activity itself. It may be looking at the item, it being in the room, touching the item, not necessarily engaging in the activity itself. Breaking down the activity may include, having the child get used to being in the same room as the item and just looking at it. And everything that we do, we want to individualize for the kiddo and make sure that it's meeting the needs of that specific child. So a question that we get as professionals is, it's the right, how often do we implement it, like in a session? What's our goal when it comes to how many opportunities, how many trials should we provide during a session? And it really is up to the child and how much you can balance, how much fear are they experiencing or demonstrating per that definition within a session. And so we just want to make sure that we're checking in with what the kiddo's doing and making sure that we're finding that balance. I already talked about mastery, and I already talked about data. It's really important. It helps drive all our decisions. So data can look like what I said earlier, like there's a correct and incorrect as to what the child needs to do in order to move on to phases. So that was explained earlier, but could be what a data sheet looks like. Trials being 1, 2, 3, 4, 5. What happened? Was it? So what this data sheet I think is speaking to is that when you are breaking down the task, you're not forgetting to do the earlier elements within the hierarchy that you're presently doing. So let's say for nail trimming, I am putting, at this point with this kiddo, I'm putting the nail clippers inside the nail but not clipping. That's where I'm at, let's just say. So even before I get to that point, there might be a point in my session that I'm still checking in to see that the child is still where they are at per the data. So I may start just putting the nail clippers in the room, bringing them closer to the child, putting them on the table, checking in with that reaction to see, have there been any changes since the last session? I think that's what this data sheet is speaking to, because as you can see, there's a date and there's multiple phases per row. So that could be what that is speaking to. So in summary, for part 1, because remember, we got 2 parts to this bad boy. We want to define the problem behavior. We want to identify the function. We want to determine, are we going to use systematic desensitization for this child? And if systematic desensitization is appropriate, we're going to create a task analysis. We're going to determine how can we reinforce this child throughout the process, throughout the stages and the steps. And we're going to fade in the stimuli while fading and shaping the behavior that we want to see at the end. These are the references. If you go to the YouTube thing after this, so it's all said and done, it'll be posted there. You can go to this, click pause on the video, and boom, boom, got it right there. That's how you're gonna have access to this information afterwards. So let's talk about the toilet. Emily, I'm just like feeling like you're the only, we have some great attendees right now. I just see your face, so it's like I'm talking to you. Do we have any comments or questions so far? Am I frozen? Are you frozen? I think you're frozen. It doesn't look like we have any comments. So I'm gonna keep going. All right, what am I talking about here? Toileting. And when I say void, I'm saying poop or pee. That's what that means. So terminology out the gate, we're here, this is what it is. Okay. So let's just start the foundation by creating some realistic expectations for everyone involved. The typical age that toileting begins is between 3 and 3.5 and 4.5 years of age. And that, I think, is a great starting point when you're thinking about your own child or the child that you're working with. And there is a difference between teaching readiness skills of toileting versus toileting, like having the child go to the bathroom. So there are two differences. You may have a client or a child that is 2.5, and you're not necessarily ready for them to be out of diapers, or they're not showing really readiness to be out of diapers, but you can begin to teach the independence skills, the readiness skills of what goes into going to the bathroom. So when we're thinking about readiness skills, we want to break it down to by age. This was taken from the VB-MAPP, which is created by Mark Sundberg. That's his last name. Yes. Emily, are you nodding your head? Yes. Okay. Got it. All right. So we want to see, first and foremost, does the child respond to reinforcement? Can they follow simple directions? Do they seem uncomfortable in a soiled diaper? Can they remain dry for up to 2 hours at a time? Bowel movements, are predictable and regular. Can they pull down their pants? This whole list of things. We're looking at that for readiness skills. And if we have a client that is 2 years old and we want to start, thinking about toileting, we first want to start here. We're not, we want to check in with, the social appropriateness of where the child should be for their age. Toileting by 36 months. So, can they communicate, or have they learned a word for the toilet or going to the bathroom? Man's in the world of ABA, requests, those words are interchangeable. Requests to use the toilet. So these are all things that we're looking at. Do they have these skills? If they can urinate on a toilet, that may be one thing, but can they do that consistently? And can they put, I need to go to the bathroom, and going on the bathroom together? Because sometimes they can say, I need to go potty, but they've already gone to the potty and their pants. So we have to make sure that those skills are together, because that's important.
Big step.
It's a big step. So then, we're 48 months here. So we're getting up in the age bracket. These are kind of the expectations of what we're looking at as a professional, as a check-in, to be like, okay, by 48 months, we want our client to be able to do these things. And these things by 36 months. We want to be able to see if our child can do that, client. So now what? This individual looks very perturbed. And I think a lot of parents feel the way of this cartoon. Yeah. More times than not. Like, what am I going to do? Yeah. What, we think our kid's ready. We checked in with the readiness skills. Boom, boom. Kids got it. Now what? So, remember what I said before, whether we're teaching a skill they're afraid of or not, we're going to break that bad boy down to a task analysis. So first, we got to look at the readiness skills. Check, got it. So we're going to break down toileting into a sequenced task, sequence steps. The picture of the steps covered the word steps. That's what happened there. So
it works.
Yeah, it works. It works. So I'm a big fan of teaching independence around the steps rather than focusing on voiding. I have found a lot of success with that approach. It provides a lot of opportunities for positive reinforcement to say, great job, getting the toilet paper. Great job flushing. These skills that go into toileting, by focusing on how they're doing with the skills rather than the sole focus being like, you didn't go on the potty, flat face, like whatever. Like they're sitting on the toilet for 3 seconds. Great job trying. We're done. And then while we're giving them opportunities, we'll see a greater independence around going to the bathroom. And then by the opportunities of practicing that independence with that skill, gains more comfortability with going on the toilet. Because the toilet's like a scary big mouse, porcelain mouse. it can be scary to kids. So we want to make sure.
Noise.
Oh, what did you say, Emily?
Really loud, makes funny noises, things disappear.
Mm-hmm.
Yeah.
It's so loud. It's so loud. And we work with kiddos with autism in our program. And I mean, some noises sound really cool, and maybe it's cool to some kids, but it's loud, especially in a public restroom, with all that tile and porcelain and stuff. So the pressure to void is a huge pressure, and I mean, it's understandable, the desire to have your child go on the toilet. I think it's important to reframe that conversation to how much independence a child is gaining from opportunities to use the toilet and use it correctly, and then helping understanding come with, this is a great skill set that is going to have a great and positive impact on the kiddo. So it's a process of getting there for sure. So once we say, okay, our kids ready for toileting, we're going to break down the steps. We're going to teach them in sequence. We may use backwards or forwards chaining. So backwards chaining is assisting with each step and then having the kiddo attempt to do the last step independently. Forward chaining is having the child do the first step independently and then providing assistance for the rest of the sequence. Now, in my professional opinion and my own data from my collection of years working with kids would say that backwards chaining, and I'm sure there's research to support this, there is, that says backwards chaining when teaching a skill provides an opportunity for more reinforcement to take place so that there is a greater increase in the skill that we want to see, because that's how reinforcement works. Behavior occurs, reinforcement is provided. If the reinforcement is what that child wants, we see an increase in that behavior, and that is how positive behavior works. Got it. Okay, so with backwards chaining, if we're providing assistance with every step and then we're providing that reinforcement along the way, okay, so, and then the last step, we're like, all right, flush the toilet. And they flush it. Awesome job flushing. Yeah. And it just provides a lot of opportunities for reinforcement. And the last step, flushing the toilet, sometimes not always fun. Maybe the last step is putting the step stool back underneath the sink. It just depends on the kid. But yeah, again, task analysis may look different for every kid because you're breaking down that step. That big skill in the smaller steps. So what do the steps look like? This is a sample of a data sheet. So we have just data gathering. Is a child dry before they even come to the bathroom? Pulling down their pants. Were they provided a full physical, partial physical, verbal prompt, or were they independent? That's what FP, PP, VP, and I stand for.
Nailed it.
What?
Nailed it.
Sat on the toilet, type of void, did they urinate? Was there bowel movement? Was there both? Were they dry? Yeah. Grab toilet paper, flush toilet, wash hands. And this task analysis may look different for every kid. Let's say that, you're looking at your data and you're like, man, sitting on the toilet gets a FP, full physical prompt, 90% of the time, and a lot of these other steps get either maybe a verbal prompt or an independent 90% of times. That's where, as a professional, we're analyzing our data on a regular basis, and this is why we need to check in. We need to see, how is the treatment working? Is it effective? And I'm seeing, as a professional, man, sitting on a toilet, that's not going so well if he needs that much physical guidance for that step. So maybe we need to break down sitting on the toilet into smaller steps. Maybe we need to bring bring over like the step stool. You know, can the child get on the toilet? You know, what's happening there? Does the child have, you know, the gross motor skills to sit? We got to check in with this stuff, making sure that where we need to break it down smaller, we can break it down smaller. Emily, are there any questions or comments?
You nailed it. No, we don't have
I've done it a few times.
I know.
But
we don't have anything.
Thank you. But I definitely always have room to learn more. So yes, so quick words about boys and potty training. Very interesting. Research shows that until your son is consistently or showing independence with skill in minimal to no accidents, teaching him to sit for all toilet experiences. I don't know why I put it like toilet experiences. Voids. Yeah. Let's just keep it clinical here. Voids will likely result in consistent success. So teaching a boy to stand right out the gate for peeing versus pooping can create confusion. So we want to make sure that consistency can take place, that there might be a time naturally that the kid wants to stand, and that might be the appropriate time if that readiness is shown. If not, redirection to sitting is important for the overall success of the kid. But I think that's important to know, because some parents may have confusion about that. And it's research. It's research based. So there's research behind showing what the difference between teaching a child to stand right out the gate and teaching them to sit for all voiding in the toilet at first. Oh, well, I got ahead of myself. Look at that. There's a slide saying all the things I just said. Okay, here we go. How long should my kid sit on the toilet? I get that question a lot. Do you get that question, Emily?
Yes.
Yes. In the beginning, like I said, it's super important to just focus on building that independence around going to the bathroom. Like, I cannot emphasize that enough. That positive reinforcement that a child receives from the experience of going to the bathroom just makes it positive. It's just so positive. You know, it becomes not such a daunting task. It's like, yeah, I'm gonna go potty. I'm gonna try to go potty. I'm gonna get some verbal praise, maybe some high fives, maybe my favorite song while sitting on the toilet, ABCs, you know, it becomes fun. And we want to think of sitting on the toilet as part of the task analysis, not the pinnacle of the skill. So sitting on the toilet, short term, one short song, whatever, is just part of the task. Sitting on the toilet is part of going to the bathroom. So we just want to keep it just as long as we would any other task. Now, if our child is showing physical signs that they are going to the bathroom, like maybe some grunts, maybe some eye squints, then we're not going to pull them off after 30 seconds because we want to respect that they're going to the bathroom. So we want to encourage them. Hey, it looks like you're pooping. Great job trying to go on the toilet. And then we're just going to stick with them. And then we know our kids and our clients over time. We will definitely get to know just the indications that they give us that they're using the restroom. So we will understand what's happening and be able to meet our child where they're at. Catching the child going to the bathroom is super important. A toileting program in ABA is pretty intensive because we're taking our kids, every 30 minutes to 45 minutes when the program is active. Sometimes even more than that, sometimes every 15, because we want to give them opportunities to go to the bathroom, practice those independent skills so that they become more and more comfortable with going to the bathroom, helping them say, we're going potty, and then giving them that language connected to the skill. It depends on the kid, again, how often they're being taken, but if they're first learning the skill, they're showing signs of readiness, we are taking them often, more times than not. So we may also give them a lot of water throughout the session to just hydrate them enough to kind of get them going so that they are motivated to go to the bathroom. And this is all discussed with the parent prior to treatment being implemented so that everyone can feel comfortable about what's happening. Because at the end of the day, toileting is, important skill and sensitive because we're working with the client clients on a very intimate level. So we want to make sure that everyone is on the same page and everyone feels good about what is taking place. Potty party. Look at this. Look at all these kids go in the bathroom. It's important to celebrate when your kid does go on the bathroom. So even though it's a part of the task analysis, it's a part of the skill, we're still celebrating our kids for engaging in the voiding behavior. So happy. Oh my goodness, look at all these happy faces. So when we're thinking about, one thing I do want to touch on when we're thinking about how do we get our kids to go to the bathroom, how do we provide reinforcement? Reinforcement is not the same for every kid. And we want to remember DISC, which is my favorite way of remembering reinforcement. I should probably make like some sort of like infomercial on this acronym.
I'll expect that by Wednesday.
Okay, good.
Yeah.
Okay, I'll get my green screen for Zoom.
Great.
That'll be good.
Perfect.
So remembering DISC. So D is for deprivation. So if you think about Thanksgiving, it's super reinforcing to us because we've gone all year without that green bean casserole. I love green bean casserole.
Me too. That's
you do?
Yeah.
Yeah, I love it. And I really only have it around Thanksgiving, maybe Christmas, but it's not an all year thing. Nope. So when it happens, I'm like, yes, I'm so excited. And then I eat it and eat it and eat it. And then I have leftovers. And then I eat it for like a week. And then I'm like, I'm done. Mm-hmm. So deprivation is getting to the point before I'm done. Because if I get filled up with it, we don't want it. So if sometimes we say to our parents, you know, these toys, these things are only for ABA therapy or only for toilet training because it creates deprivation, it creates desire for those things. So if I know I'm only going to get my cool robot, you know, after I go to the bathroom, and when I say go to the bathroom, I'm not talking about voiding in the toilet, I'm talking about doing the experience of the bathroom, then it creates reinforcement and we're going to see that behavior more. Immediate. So reinforcement has to be immediate in order to be effective. So it has to make sense to the timeline in which we want that behavior to be seen. So yeah, immediate.
It can't be a trip to Disney World.
No.
Can't be a trip to the ice cream store.
Yeah, at the end of the week.
Yeah.
And right if you are going to utilize that sort of schedule of reinforcement, there has to be some visual cues along the way to remind your child what they are working for. And there still has to be some sort of immediacy to the reinforcement in order for it to be effective. So yeah, size-worthy. You know, size-worthy means that the reinforcement is enough for the individual receiving that reinforcement. So it may not be enough for me to have just one scoop of ice cream for me to engage in the task. I may need like 5. I do not encourage you to give 5 scoops of ice cream to your clients or kids.
Please don't.
Please don't. It's just a visual form of, you know, this is size worthy to me. It's going to keep me going. It's going to keep me motivated. It's going to continue to be effective for me. Contingent. So reinforcement has to be contingent on the child engaging in the task. So if we ask our child to complete the task analysis for toileting, I mean, not saying it like that to the child, like, please complete the task analysis for a toilet. We're not going to talk to kids like that. But, you know, we're not going to give the reinforcement if instead they went down a slide.
Yeah.
You know, that's not going to be contingent on the behavior that we want to see. So you guys are doing great, hanging with us. We're almost there. It's been a pleasure. I had time check. Oh, we got 3 minutes. We're doing it.
You got
okay. So establishing motivation. When we look at reinforcement and toileting, we want to be careful that we are not withholding items that are natural to the need of the child. And there's a difference between deprivation of a preferred candy or snack and deprivation of meals. We don't withhold meals. So, summary tips. Go often. Push those liquids. Move to underwear when the child is showing independence with skills, consistency, and persistence. Voiding comes with that. There is going to be a point clinically too that we may put safeguards in, maybe some plastic underwear. They sell them at like local grocery stores that go over the underwear. I think Gerber makes them for that transitional time if parents are concerned about leakage all over, because there's going to be accidents. There's going to be accidents still in that transition time, but the accidents are going to be fewer. Do you agree, Emily?
Yeah.
So there's going to be a point clinically that I'm looking at the data, and data drives our decisions. And I'm like, listen, this kid is showing 95 to 100% independence on all tasks related to toileting and voiding in the toilet 95 to 100% of the time while still in pull-ups. It's time. It's time. The data is showing us we have to wear underwear now. And even with the data being that good, there may be an accident here and there. However, we are now teaching the child, it's time to go. It's time to put words to when you have to go to it. And we're teaching those skills along the way, but there is a time that we're like, it's underwear time. Yep. And then research about teaching a boy to sit, to go to the bathroom, assist with consistency. Here are the resources. Again, if you have watched this later or you want to look at these resources again, you can go to the YouTube site and then you can just click on the video and then go right to the resources and pause it and boom, boom. Now, that's the end. Okay, so I do want to say that just real quick before we end today, that the educational series is moving to only Mondays, and it is at this point ending June 15th. If any of that changes, please check in with the Health West site, the virtual groups page. It will keep you informed. We appreciate you joining us so much, and we hope you have a great evening, and we will see you next Monday at 4. All right. Bye, everyone.